Hello.
Oh gosh.
I was trying to get in the spirits of the Halloween, the weekend before Halloween. So my name is Eric Prosher, and I have two special guests today. One is Ms. Desiree Azizodin, and the other is we have one of our old favorites, Dr. Shapuri, will be back, and both of them will be talking about what Jesse Brown VA is doing to address veterans' health. So they are two special guests, and you're watching a live call-in interactive program brought to you by CAN TV 21. And so over the next 20 minutes, Dr. Shapuri, the coordinator of our PCMHI clinic, is going to be talking about what they're doing to address sleep and the new initiatives that will be beginning at Jesse Brown to help veterans with insomnia. And Desiree, thank you, Desiree, is going to be talking about smoking cessation services, the Great American Smokeout, and a new relaxation group that's beginning in primary care setting?
Yeah.
Something like that?
Throughout the hospital.
Okay.
Yeah.
Well, thank you. So call in with your questions at 312-738-1060. All right. Thank you for coming on. Why don't you tell us a little bit about yourself and what is your role at Jesse Brown VA, and how are you a part of this health initiative addressing all these health-related behaviors like smoking cessation and
absolutely
relaxation and
all that fun stuff,
obesity and all that stuff. Yes.
So I am in my graduate training program to become a psychologist, and I am currently the health psychology intern working with the health behavior coordinator and some of the other health psychologists at Jesse Brown. So we have a number of different clinics that we help provide some information for.
Information, great. Yeah. We have a caller already. This is good. Hello, caller. Hi.
Hello.
This is Dominique. Hello?
Hi, Dominique.
Can you hear me?
Yes,
Hi.
We can hear you.
Okay, so I have a lot of veterans. Sleep issues, a number of problems. And my question is, where do I direct them? How do I get them to the programs that you all are promoting so I can get them healthy?
That's great. Do you work at Jesse Brown? Work with
I do.
veterans?
I work in primary care social worker.
Excellent. I'm so glad that you called in today. So we're talking to Desiree right now, who is talking about some of the health initiatives to address a wide range of health behaviors for veterans. And so why don't you talk about some of those initiatives, and then we'll talk about how to get there, and then we'll also later on talk with Dr. Shapuri about how to get involved with their sleep group there. So
Perfect.
Hold on with us, and we're going to go for a ride.
Yeah. So
okay.
If you're interested in smoking cessation services, we offer a variety of different services, including medication management, nicotine replacement, but also behavioral counseling. And the research has found doing both together in conjunction can help you quit the most successfully. So that includes doing things like nicotine patches, a top gum and lozenges, and potentially coming to our smoking cessation group on Wednesday. So for instance, if you had a vet who was interested in quitting smoking, they can go to their primary care clinic down on the first floor of Jesse Brown VA or at one of the CBOCs, ask the primary care physician to get involved or to get nicotine replacement medication, and come to our group, which is every Wednesday at 11 a.m. in the patient education room near the library. So that's a drop-in group. You can come whenever you'd like.
And if you have any questions, is there someone that they could call for that?
Yeah, so they can call Dr. Sarah Catanese, and her number is 312-569-8505.
Wow. So Dominique, thank you for calling, and you probably are wondering, like, why is it important to stop smoking, right? That's what you wanted to ask, isn't it? Dominique?
Hello?
Hello. Okay.
Well, we can
she's
talk
gone.
about why it's important.
Why is it important? And,
Yeah.
And tell me a little bit about veteran smoking in particular.
Yeah.
What do we
so-
know about that?
Yeah, so we know that veterans have a higher rate of smoking than the average population. Currently, we have seen a decrease in veterans and the average population from 20% in 2005 to about 17% in 2014.
Oh, wow. So there's a decrease. We have another caller. Great.
No, it was me. My phone disconnected, so I was trying to get
Call
that
back.
information. I'm sorry.
Okay.
Yeah, that's okay. Thanks
Great.
for calling us back.
Desiree was just giving us a rundown on why smoking cessation is important, and there's some statistics related to smoking.
Yeah, and so we found that smoking, compared to other causes of death, is the number one leading cause of preventative death. And so
Wow.
some of the other things that they found in the research is that smoking is related to a variety of diseases, including things like cancer and heart disease and lung disease, diabetes, erectile dysfunction, so a number of things that veterans are dealing with. And we know that engaging in some form of smoking cessation treatment or both combined can really lead to some successful changes and improvements in health. So if you're interested too, November as a month actually will be reviewing what's called the Great American Smokeout on November 17th. So throughout the month we have a bunch of different activities going on at the VA, and on the 17th we'll be getting vets connected so they can figure out what are some options for quit plans and things that they might be interested in to help them quit smoking.
Great.
I'm going to definitely direct some people to you.
Great, thank you. Do you want me to repeat
Yes.
the number for you?
You know, are you in the, yeah, you know what? Let me write it down. Go ahead.
Yeah, it's 1-312-569-8505. Or they can ask any of their primary care physicians to get connected with the smoking cessation clinic.
Perfect.
Yeah,
Thank you so much. I appreciate that.
yeah thanks for
Thank
calling
you for the
in.
call, Dominique.
You're welcome. Bye-bye.
Bye.
I was trying to get the a slide that talked about the different deaths, top causes of death, and unfortunately we're having a computer malfunction. But you know, when we look at smoking in relationship to suicide, homicide, alcohol, obesity, AIDS, drug-induced deaths, it is, what was it, 450 per 100,000.
Yeah,
So
and it's preventable, and it's
and
preventable.
it's so preventable.
Yeah, right.
So much like the weight loss programs that we have
Yeah.
at the VA too, right? But
Right.
smoking is probably the number one most preventable cause of
Yeah, of
leading-
death.
of death. Yeah.
Yeah.
Thank you. Okay.
The other really interesting thing, so a lot of the vets that we work with talk about the amount of money that they save when they stop smoking, and I think it's one of those things that gets forgotten. So I did some calculations that I've actually done with a lot of vets, and I know some will say, oh, I'll go and buy my cigarettes outside of the city, it's cheaper, or even buying in the city. On average, we'll say that the person is paying about $10 a pack. And so if you're smoking half a pack a day and you're paying $10 for that pack, you're spending about $1,700 per year on your cigarettes, and in 10 years that's about $17,000.
$17,000, 10
Yeah,
years.
for
That's
half
amazing.
a pack a day.
And is it true? I've heard like if you know, smoking is really bad for your health, but if you stop smoking in about 7 years, your risk of developing any kind of health-related conditions related to smoking is about the same as if you never smoked. Is that have you heard that before?
Yeah, but they say that there is a elongated effect. So if you are smoking for a long period of time, it's kind of hard to ever, quote unquote, get those toxins out of your body. But people do report that even within a few weeks of smoking, that they notice differences in their breathing, in their ability
Their
to exercise, and their endurance, energy. Yeah, so I think there are significant changes that can come quite quickly from quitting.
Cool. So
Yeah.
and can you tell us a little bit about the Great American
Smokeout? Yeah.
What happens there? What's Jesse Brown doing?
Yeah, so Jesse Brown is starting the initiative, or they've had it for a few years now, but you can find a lot of information on the Facebook page. It's on November 17th. We'll have a hospital-wide initiative to help veterans get connected with creating a quit plan, or talking about how they feel about their smoking, if they're ready to quit, if they're not ready to quit, and just sharing information.
Yes.
And that'll be November 17th, the day dedicated to that.
November 17th.
Yeah.
All right. So mark your calendars. November 17th, Great American Smokeout.
Yeah.
And what is probably number one top recommendation you would have for folks that, because I heard that any given
Yeah.
time, like, is it 70 or 80% people are smoking or planning to quit at some point in their life. So this is a good thing. But what recommendation would you give to somebody that is thinking about quitting and
Is kind of unsure. Yeah, so we see a lot of people that are in different stages of wanting to quit. And if you're in the stage where you're like, I've thought about it, but I'm not really sure if I want to, we'd offer you to just come to the open group. That's on Wednesdays at 11 a.m. And you can talk to people who have quit, people who are still smoking, and just kind of get in a group and talk about your
You
smoking.
don't have to do it alone, right?
No.
You're connected, and there's support around that.
Yeah, and the group is not designated for just, if you're committed to I want to quit. Like, we have some veterans who are very committed who have quit for a while, and we have some that are still smoking and are just not really sure where they stand, but they want to come and talk about it and see what's going on in the community and not feel so alone about the difficulties that come with quitting smoking.
Great.
Yeah.
So what else is going on? What else are you doing, getting up there? What else, Jesse Brown, to address veterans' health?
Yeah, so one of the main things that we wanted to work on this year was the stress that comes with the holiday season. So over the years, we've heard a lot about how stressful it can be, having family to celebrate with, or maybe not having any family to celebrate with, or just the amount of changes that go on in the holiday season. It's the end of the year and so on. So we decided to bring a relaxation group together. And so it's a 4-session group that meets every other week in November. So twice in November, twice in December. And we are going to teach you, or hopefully you will learn on your own through some of our guidance, how to engage in relaxation. And relaxation has been found to also help with increasing your health in ways that, like decreasing your blood pressure, decreasing your risk of getting sick, decreasing inflammation. And so we hope to teach you some skills through that group. So it's a 4-week group, and we have a bunch of veterans who've already signed up, so there's interest. So if you're interested, there are a few spots left.
Okay. How does a veteran get involved?
Yeah, so again, you can call Dr. Sarah Catanese. The number's listed here. So it's
312-569-8505, and those dates again, if you can't read it in your screen at home or computer: November 3rd, November 17th, December 1st, December 15th at 10 a.m., 10 to 11 a.m. at Jesse Brown VA on the 3rd floor of the Taylor Building in the library. So, Jesse Brown, located at 820 South Damon Avenue. So come on down. And I wanted to thank you, Desiree, for coming on the show. And we're going to bring Dr. Shapori on the show, and
thank you so much.
We hope to have you back again soon. Thank you. So, hello.
Hi again.
How's it going?
Good. How are you?
It feels like it hasn't been too long since you were last here. So those of you just joining us, you're watching CAN TV, and we are Jesse Brown VA Medical Center. Dr. Shapori is a psychologist, a public health specialist, and the coordinator of our PCMI, which is Primary Care Mental Health Integration. So today she wanted to talk about the sleep and what they're doing for sleep at Jesse Brown. So call in if you have any questions. So tell me a little bit about sleep
Yeah.
and the problem of sleep in our veterans. So I have to
Absolutely.
say, I work in the transition care and management clinic, and that is the number one problem of our newest veterans coming back from deployments and acclimating back into civilian settings is sleep.
Absolutely. Sleep is a huge issue, especially insomnia among the veteran population. The estimates range in terms of prevalence or what percentage of veterans have sleep issues. There was a study done from 2000 to 2010 that looked at the prevalence of insomnia and obstructive sleep apnea in veterans and found that around 26% of veterans have insomnia versus about 10 to 15% of just the general population. So it's obviously a bigger issue amongst
Yes,
veterans.
yes.
And then sleep apnea was about 45% of veterans have
Whoa.
sleep apnea, which is a actually very bad disease
Whoa.
because it can lead to increased rates of heart disease
Yes.
and other issues, and it can actually lead to sudden death during sleep.
Yes.
So sleep issues are a big problem for veterans. In fact, a recent study by Johns Hopkins found that actually 75% of veterans, and this was a study done online, so it was veterans who were reporting statistics, self-reporting statistics online. 75% of them said that they had clinically elevated levels of sleep issues. So
Wow.
enough to have a diagnosis of insomnia.
So this sounds like a big problem for the veteran community, and
a very big
and
problem.
a big problem because sleep impacts so many different areas of person's health,
Absolutely.
including mental health, right?
Yeah, actually, they looked at the mental disorders that are associated with sleep issues, and the one that's the most often associated with sleep issues, what would you guess that would be out of all of our mental health issues?
Maybe I'm biased. PTSD or depression?
Yep, PTSD.
PTSD.
PTSD is the number one, and then depression and anxiety.
Okay, and the signature wounds of the. Okay, we have a caller. Hi, caller.
I was
You're
just
talking
wondering-
with Jesse Brown, and we're talking about sleep. What is your
Yes.
question?
I just wanted to see if you would confirm or talk about people's weight and sleep apnea. Do you actually have to be overweight to have sleep apnea?
That's a great question. You do not have to be overweight to have sleep apnea, but if you are overweight, it predisposes you to have sleep apnea because one cause of sleep apnea is that your throat kind of closes during sleep, and if you're overweight, sometimes you have a thicker throat, so that leads you to be more likely to have issues with sleep apnea. But you can have sleep apnea even if you're normal weight or even underweight.
Yeah, we need to bring Desiree back because obesity and overweight is another problem in the veteran population. Now that I heard that the percentage of veterans that are overweight and obese have surpassed their civilian counterparts, which is, disturbing and challenging, especially for the newer vets that have recently come off active duty. They gain a lot of weight, even though they've been able to maintain. You have to maintain your standards while you're on active duty.
Yeah, and I kind of wanted to talk about how poor sleep is manifested kind of in day-to-day life. So when people don't get adequate sleep, they're often more irritable, they have poor concentration, it causes problems with their immune system functioning,
That's
so
right.
they're more likely to get sick.
And metabolism,
Yeah.
they gain weight.
Yeah,
right?
absolutely.
Okay,
Yeah,
okay.
it's been associated with problems with weight gain as well. And just overall, just how you feel, it predisposes you to have more anger issues, more likely to have
Irritability,
depression.
concentration, memory.
Yeah, exactly. So getting adequate sleep is extremely important. And in our society today, I think there's always this idea of rush, rush, rush. Nobody has enough time to do anything. And so they don't prioritize sleep. But sleep is extremely important.
And the funny thing about all those symptoms you describe is that they mimic the symptoms you would have with PTSD. They mimic symptoms of a depressive disorder, or mood disorder. They mimic anxiety symptoms like over a long time. And so, as a treating provider, like that's one of the first things you want to address to get under control, so you can figure out what is the real issue there, because mental health disorders related to sleep deprivation mimic so many other
Yeah,
psychiatric
absolutely.
conditions.
And how many hours of sleep do you think somebody needs to get to feel refreshed?
Oh, what a great question. I think it's variable depending on the person. I myself I need at least 7.5, almost 8 hours. But I was reading somewhere that like teens need a lot more than we thought in the past, and the older you get, the less sleep you get, or need.
Yeah, both are right. So your sleep needs vary according to the stage of life. So you're right, when you're in adolescence, you need more sleep. When you're in adulthood, typically people need 6 to 8 hours of sleep. But there's this idea in our culture that everybody needs 8 hours. Everybody doesn't need 8 hours, but they should get at least 6. In the veteran population, average sleep is about 5.6 hours.
Wow.
And in the general population, it's about 6.7. So it's about an hour less in the veteran population, which is problematic, especially since it's below 6. And some studies have said if you get below 6 hours of sleep, it's almost like you're getting no sleep that night.
Wow.
So it's very important to get at least 6 or more hours of sleep.
Wow.
Yeah.
So we have lots of veterans that aren't getting sleep. So who are we hoping to recruit to help them? We have 5 minutes left, and so let's get some helpful information out there to the public of how they can address sleep, and then for the veterans, how they can come to Jesse Brown to get involved in your group.
Yeah, absolutely. So we have a Healthy Sleep Habits group. It is the first and second Wednesday of the month from 1 to 2:30 at
Okay.
Jesse Brown. It's in the Ogden Pavilion of Jesse Brown on the second floor, room 2320, so it's in the day hospital area. To get connected with that group, you can just show up for that group, but we do prefer that you contact us and let us know that you're coming.
Okay.
So you can do that the same way you would do actually for the smoking cessation group that Desiree was talking about.
Okay.
You can tell your primary care provider that you're interested in getting connected to the sleep group, or you can give me a call
Okay.
at 312
312
569
569
5486.
5486.
Yes.
So that's second Wednesday of every month. Sleep
First
group.
and second Wednesday.
sorry.
Yeah, it's
First-
a 2-session group.
2 sessions.
Yeah.
First and second group of every month on Wednesdays from 1 to 2:30
Yes.
on the Ogden Pavilion, second floor.
Yes.
Okay. So what can our veterans expect to get from
Yeah.
these 2
Great question. 2 sessions.
sessions?
The first
I can't
session
find my words
focuses on
today, I'm sorry.
insomnia.
Insomnia.
And so it talks about kind of the causes of insomnia and why you might have insomnia, why you may have developed insomnia over the
nightmares,
winter.
nightmares.
And the second session actually addresses nightmares
Oh.
and some interventions. We actually have some very good interventions for nightmares and insomnia.
Great.
And so the first group gives you some strategies, some basic strategies to improve your sleep. And then the second group focuses on nightmares and also a little bit of insomnia. And at the end of the 2 sessions, we talk about if you're still struggling with sleep, you can get individual therapy. You can get CBTI, which is cognitive behavioral therapy for insomnia, which actually is the #1 recommended therapy to cure sleep issues. So above medication, they
That's
actually
right.
recommend you getting CBTI.
That's right. So behavioral counseling for sleep is by far the treatment of choice because it resets retrains your body to get the sleep. Where the medications, you shouldn't be on a sleep medication for more than 2 to 4 weeks.
Yep.
And after that, you develop sensitivities. It is not going to have the effectiveness over time.
Yeah, exactly. And the other thing is that the other quick thing is that people think that behavioral treatment for insomnia is just sleep hygiene stuff. So like what you should do with your sleep environment, it's not just that, like don't drink coffee, things like
Right.
that. That's part of it, but there's a lot more
That's right.
that hits a powerful punch. So it's
Okay.
a very, very good treatment.
It's not just sleep hygiene.
Not
That's
just sleep
important.
hygiene,
It's not just
yeah.
sleep hygiene. That's part of it. Okay, well, great. Thank you. We're going to wrap it up. I'm Eric Prosher. This is Dr. Shapori. I forgot your first name.
Smriti.
And we're from Jesse Brown VA Medical Center. Hey, if you have any questions, call us at 312-569-VETS. And you're going to, coming up, is going to, please stay tuned for the West Garfield Park Youth Council. And there's a Veteran Town Hall on November 9th from 11. So come, if you have any concerns about your VA care, come get heard there. And check us out on Facebook. So Facebook /VA Chicago. please stay tuned for our next guest, and thank you for your time. Bye-bye.